Welcome to UMHC Take 2. Hi, I'm Dr. Rodney Meeks, and my specialty is urogynecology. In this segment of UMHC Take 2, I'm going to address the issues of diagnosing and treating urinary and bowel incontinence.
Hi, I'm Amy Hicks. I'm a registered nurse, and I work with Dr. Meeks when a patient has urodynamic testing, which evaluates bladder function.
Pelvic floor function involves bladder and bowel continence. Normal function is interconnected and complex, which can be affected by several conditions. Pregnancy with its associated weight gain, stretched ligaments, and pressure from the baby's head on nerves in the pelvic floor are all stresses that may damage the pelvic floor. These factors can also cause vaginal bulges or prolapse, potentially interfering with normal everyday pleasure and even sexual pleasure. Elective C-sections were thought to prevent incontinence in many women who have had one, but many women still go on to develop issues with both the bladder and the rectum. Age also impacts excretory control. Muscles become looser, and Kegel exercises can only do so much. Women may find themselves wearing a pad, limiting social activities and physical activities just to cope with what can be a very embarrassing condition. In fact, incontinence is the #1 factor for those deciding to enter an adult care facility. Successful diagnosis is the first step and leads to a cure in roughly 85% of incontinence cases.
Diagnosis is performed at UMHC's Urodynamic and Pelvic Floor Assessment Lab. We start with a routine exam, which is a lot like an extended pelvic exam. The patient is placed on a special chair to first measure any bulges.
Then a small catheter is inserted into the urethra and is used to watch how the bladder reacts as it is filled with fluid. A cystoscope is then used to look into the bladder. We may ask you to demonstrate what causes the loss of control: a cough, jogging in place. Then we measure the amount of leakage. Physicians assess anal musculature to determine how well the patient can control pressure by squeezing their anus muscles. Leak point pressure on the urethra tests weakness in the muscles that hold back urine. Maximum urethral closure helps determine the strength of the muscles keeping the urethra closed naturally. These tests can help us decide if outpatient surgery is needed or if we need to prescribe antispasmodic medications for urge incontinence. If incontinence is interfering with your lifestyle, it may be as easy as a short trip to UMHC and a simple exam to take control of these issues.
I'm Amy Hicks.
I'm Dr. Rodney Meeks.
Thank you for watching UMHC Take 2.
You can learn more about other medical procedures by visiting umhc.com.